Hi, I'm Dr. Mark Poray, a sports and family chiropractor in Brooklyn, Ontario. I'd like to talk about what chiropractic is and why people choose to see chiropractors. Chiropractic is actually the second largest primary healthcare profession, and it focuses on the neuromusculoskeletal system. In other words, chiropractors focus mainly on disorders related to the spine, pelvis, and nervous system and peripheral joints. The word chiropractic comes from the ancient Greek word, and it means done by hand. While the art of healing by hand was practiced by the ancient Greeks, modern chiropractic was actually formalized in 1895 by D.D. Palmer in Davenport, Iowa. Interestingly enough, Palmer actually came from Port Perry, Ontario, so he was a local fellow. In its early days, chiropractic was extremely controversial because of its vitalistic philosophy. In more modern times, it's taken a more holistic approach. While many of its claims were based on metaphysical principles, there has been a great deal of good research in the last 30 years to support the science-based claims of chiropractic's effectiveness. This is because chiropractic research in Canada follows the Cochrane guidelines, which are extremely rigid. Of primary interest is that the nervous system is the body's information highway, and the spine protects that system. The essence of chiropractic is that the nervous system travels in and out between the vertebrae or joints of the spine to carry messages back and forth between the brain and the organs and muscles. Stress and strain on the vertebrae can put pressure on the nerves in the affected areas. That is why a problem with your spine can have far-reaching effects, causing problems in the gut or arm and leg pain. Since nerves control not only sensations but functions as well, the results can mean not only pain but also dysfunction. The next important point about seeking chiropractic care follows the basic tenets of progressive health treatment. That is, in treating any condition, you always start with the least invasive form and work your way up to the most invasive. That means that when you have a headache, you do not start with brain surgery. You start by examining the possible causes and try to affect those causes in the least invasive manner. If a person's symptoms fall in line with accepted scenarios for chiropractic, then you search for signs that also fit those particular scenarios. Once that's done, you look for red flags. So red flags are those things that come up in the history and the examination, raising your suspicion that the problem may be more serious than it first appeared. If things appear as you hope, and the causes in the spine also appear to fit, then you proceed with a plan of therapy. This plan, due to the nature of chiropractic, is the least invasive because chiropractic is considered to be a conservative, non-invasive therapy. A reasonable treatment protocol is considered to be about 12 treatments to bring some positive results. Now, that doesn't mean that you get complete resolution in 12 treatments, but at least some good results should come in that progress. If there is no such change, then the good clinician will consider referring the patient for another approach. This may mean another chiropractor or some other therapist, and further lab tests or even a specialist. Now, assuming that the conservative approach does not work, the next approach should be a pharmaceutical or drug intervention. Drugs are considered to be a more aggressive approach than chiropractic because you're putting a substance into your body that was not put there by nature. In this case, you're trying to affect the course of your body's function by temporarily invading it with a chemical substance. In most cases, once the condition is under control, the chemical intervention can be discontinued. In some cases, this intervention may just mask the symptoms without a cure. In some cases, it modifies the way the body works over a long term, and in other cases still, it is a means of control, or it is meant as a controlling agent for other factors that may be affecting your body. The third and final approach, the one that most people consider as the last resort, is the surgical approach. That means that short of an emergency situation, this method should be considered last. one of the things that many people forget about surgery is that it requires disrupting healthy tissues. In other words, you have to cut through healthy tissues to get to the affected ones. Once nerves or muscles have been disrupted by physically cutting them, there's a high chance that those previously healthy tissues will now be scarred and may not function the way they once did. So, for a surgical intervention, the patient and the doctor need to decide if the possible upside of the surgery outweighs the possible downside of the process. There are a number of different approaches to patient problem solving. Some chiropractors will practice using only manual manipulation or mechanical or tool manipulation. Others will add nutritional manipulation, electronic adjuncts like ultrasound, lasers, electrical stimulation, and even acupuncture, soft tissue techniques, and therapeutic exercises. The thing they all have in common, all these chiropractors, is the approach is a conservative one and is based on correcting the cause where possible. People have a variety of reasons and accepted paradigms for seeking the care that they do. Some people are satisfied with pain control, and others seek causes for their condition and look for a clinician who can address their concerns. Many people are dissatisfied with whatever their current health care protocols are. They want to be part of the process, and they aren't accepting everything that they've been told. These are the people that seek out chiropractors. The current medical system is slowly coming around to accept alternative approaches, and hopefully a smooth and seamless integration can be accomplished sometime in the near future, so that people will be able to move unimpeded from the conservative to the most radical interventions as they require without any prejudice. Currently, the most common reasons for people to seek chiropractic are 1. Back pain, 2. Neck pain, and then 3. Headache, whiplash, strains and sprains, repetitive stress injuries, work and sports injuries, arthritis, limited ranges of motions in the back, shoulder, neck, and limbs, and generally health and well-being. So chiropractic is a skilled, hands-on care that relieves pain and helps your body be its best. It cannot, and should not be practiced by anyone other than a licensed chiropractor. There are some additional ways it can help. 1 is better posture. 2, prevention of work-related muscle and joint injuries. It can enhance athletic performance. It improves flexibility. It can relieve, and I have a blog on this, relief of pregnancy-related backache, and it can help to correct gait and foot problems. So remember that chiropractic is a regulated health profession recognized by statute in all Canadian provinces and American states. Almost 2 million Ontario patients will rely on chiropractic care every year to help them live happy, healthy lives. I hope this has been helpful to you. I'm Dr. Mark Poray. I invite you to see my website at www.drporay.com or make an appointment to see me at the Brooklyn Family Health Center by calling 905-655-5767. Thanks.